The mandible is the largest and strongest bone of the face. It is located inferiorly in the facial skeleton. It forms the lower jaw and acts as a receptacle for the lower teeth. It articulates on both sides with the temporal bone, forming the temporomandibular joint. The mandible can be divided into two portions, the anterior portion, which consists of the body, and the posterior portion, which consists of the two vertical rami. The body and the rami meet on each side at the angle of the mandible. The body of the mandible is curved and shaped much like a horseshoe. It has two borders, the alveolar border, which is the superior border, which contains 16 sockets to hold the lower teeth, and the inferior border, which is the base, which serves as a site of attachment for the digastric muscle medially. The body of the mandible is marked in the midline by a mandibular symphysis. The mandibular symphysis is a small ridge which represents the fusion of the two halves of the bone during development. Around the symphysis is the mental protuberance, which forms the shape of the chin. And lateral to the mental protuberance is the mental foramen, which is located below the second premolar tooth on each side. It acts as a passageway for neurovascular structures. There are two mandibular rami, which project perpendicularly upward from the angle of the mandible. Each of these ramus consists of mainly three parts: the head, the neck, and the coronoid process. The head is situated posteriorly and articulates with the temporal bone to form the temporomandibular joint. The internal surface of the ramus is also marked by a foramen called the mandibular foramen. It acts as a passageway for neurovascular structures.